What's going on, guys? It's Nate Humphrey, and today we'll be talking about Rasmussen's Encephalitis, RE. I'll just say RE for now on. It's a very rare condition that involves long-term worsening inflammation of one hemisphere half of your brain. Another name for it is Rasmussen syndrome. The inflammation leads to frequent seizures or epilepsy and progressive and permanent brain damage. This leads to loss of functions of the affected brain hemisphere. As the inflammation progresses, it causes worsening weaknesses in one side of your body and mental decline. The condition is named after Theodore Rasmussen, a physician who described it in 1958. How rare is the RB? It is very rare. Researchers estimate that it affects about 2 out of every 10 million people. RB most commonly affects children between the age of 2 and 10, but it can affect adolescents and adults as well. What are some of the symptoms of this? It typically is a seizure. It can be several different types, such as generalized tonic-clonic seizures, seizure that causes strong muscle movements on both sides of your body, including convulsions. Focal aware seizure, a seizure that happens while you're awake and aware of what's going on. It may cause symptoms like twitching of one hand or arm. Focal impaired awareness seizure, a seizure that begins on one side of your brain. You have a chance in your level of awareness during some or all of it. If you or your child has a seizure, it's important to see a healthcare provider as soon as possible. Mild weakness in your child's arm or leg is another common early symptom. The seizures usually become frequent, and half of the people with the RB have epilepsia continua, EPC. When seizures happen every few seconds or minutes, the seizures are also intractable, which means the medication can't completely control them. Within a few months to a couple years of the first seizure, these symptoms typically follow. Mental decline, such as issue with thinking, intellect, and memories. Progressive loss of motor, movement skills on one side of your child's body. This sometimes leads to paralysis on one side of your children's body. Progressive loss of speech and language ability. This happens if RE affects the side of your child's brain that controls most language functions. It's usually the left one. Partial loss of signs and of your visual field. For most people, it is more severe during the first 8 to 12 months after it starts. After it seems to slowly or stopping, but the neurological damage is permanent. What causes this? Scientists don't know what actually causes this, but they have two theories. The autoimmune disease. An autoimmune disease happens when your immune system attacks healthy tissue for unknown reasons. Researchers think RE may be an autoimmune condition that affects one side of your brain. Infection may be the result of an unknown virus entering your brain. However, the researchers haven't identified a specific virus, despite careful studies of the affected brain. How is this diagnosed? Healthcare providers diagnose RE based on your child's symptoms and certain test results. The first one is a magnetic resonance imaging, MRI, and that can show the atrophy, loss of brain tissue on one side of your child's brain. A specific pattern of worsening atrophy over months or years is a significant sign of RE. The next one is electroencephalography, EEG, can also help diagnose the condition. An EEG records your brain's electrical activity. The combination of symptoms and signs alone with imaging confirmation of worsening brain hemisphere atrophy is necessary for the diagnosis of this disease. How is it treated, or if it even is? There's no cure for this disease. Instead, the goal of treatment is to manage symptoms and inflammation. Treatments may include anti-seizure medication. Usually doesn't completely manage this, but they may help decrease the frequency and the severity of the seizures that you may have. Immunotherapy. At the beginning of RE, it may help manage seizures or prevent further immune-related brain damage. Or the next one is going to be brain surgery. It is the most effective in treating seizures in RE. It involves surgically removing or disconnecting half of your child's brain. Most children who have this surgery have also lost the function of the affected hemisphere. The risk of further loss of functions after surgery is minimum. Providers always consider surgery when its benefits outweighs its risks. Alright guys, I hope you guys enjoyed. If you did, make sure you give it a thumbs up, hit that subscribe button, turn your post notifications on so you never miss out. I love you guys. I will see you in the next video. Stay safe.